Hi everybody, welcome to our Corona Journal update. It's Friday the 12th of June and we just thought we'd show you around the clinic. I've finished all of the policies and procedures that I was talking about last time, thank goodness, and I've been risk assessing the patients all week and we're ready to go. Because on Monday the 15th next week we're opening the clinic to face-to-face hands-on physiotherapy sessions with the patients that it's safe for. And as you can see, this is normally a very busy business park with jam-packed full of cars, but it's totally empty. But that's because everybody's working from home. So come on in and let me show you the clinic. Okay, so come on in and see what we've got ready for face-to-face treatment. We've got our hand sanitizer everywhere for people to use. We've got posters about sanitizing hands. We've got our hand washing area here in the accessible loo. We've got our COVID secure poster, which is showing that you print out after you've completed the government policy about keeping the workplace safe. And that's there in a couple of places for reassuring the patients and the staff. We've put posters and signage up about face covering. We're asking all our patients and the people that bring them, relatives or friends or guests, to wear a face covering, which is going to be really helpful in keeping everybody safe. We've got our screening posters, making sure that people don't have any of the symptoms of COVID, and if they do, they need to cancel the appointment in the morning and tell us that they're not coming so that we can help advise them. And of course we will have checked that before they come as well. We've got social distancing posters up, asking everybody to keep 2 meters apart from the actual moments when they're having hands-on physio. We've put our 2 meter stripes all the way through the gym on the floor, helping everybody to identify how big 2 meters is. So that's great. Everything's been deep cleaned the last couple of days. Everything's ready. And then coming into the clinic area here, separate clinic treatment rooms, our patients will come straight in. We're staggering the treatment session times so that we don't have more than a couple of patients at any time arriving or leaving. So we're staggering the start sessions. We're asking relatives or guests that bring our patients to assist them into the clinic from the car with their face coverings on and straight into their identified clinic room. And then the relative or guest can stay with them in the clinic room, just one other person in the room with the patient, or we're inviting them to stay and wait in their cars. But we're not using the waiting area because we don't want groups of patients or relatives gathered together. So this will be empty. You can see we've cleared away all of the equipment. This was kettle, cups and mugs and coffee and tea area. That's all cleared away. We can't offer refreshments at the moment because they're multiple touch surfaces and we've had to clear all that away to make everybody safe. And then in our treatment rooms, we've cleared everything away again. So our shelves are empty because we have to do enhanced cleaning in between each patient session. So the least amount of equipment and surface covered is the best for us. So that gets wiped down. The equipment's away in boxes that can be wiped down. That's all there. We have our COVID consent forms that the patients are signing before their sessions, which is good. And all in all, we think we're ready. We've covered our pillowcases in wipe-downable plastic, and we've taken away any extraneous pillows or towels or fabric, so that's really clear and safe, and that's us ready. So on Monday 15th we've got our first patients face to face for their physiotherapy sessions. We're very excited. We've laid out all our staff PPE here in this room. So in this room, we've got our aprons ready, gloves, fluid resistant surgical face masks, and our face visors ready for the staff to use. We've got our PPE bin, and everything's laid out and ready. So we're very pleased with that. We think we're ready. All our policies are done, and they'll be in that room too for people to review if they want to. All our PPE has arrived, and we're very excited about our patients coming on Monday. BBTA is doing well. I've been in touch with Mary Lynch-Ellerington and Lynn Fletcher and Helen Lindfield, all of the tutors that are sorting out their clinics as well and getting themselves ready. Mary has been on to the CSP webinar opportunities, which she's found helpful, and has shared some of that information with myself, so that we've been able to talk about some of the extra things that we've added into the consent forms, and really helpful tips and guidelines. So how do I feel? Nervous, excited, glad that we can get started, a little bit worried about things we might not have anticipated that could occur next week, hoping that all the patients are able to keep their appointments and stay well, but mostly feeling excited about getting going, getting started. So next time I'll let you know how it's gone. We've got Sammy, Sean, Kitty and myself starting on Monday, so I'll update you with how well that's gone very soon. Thanks very much. Keep in touch. Bye then.